This morning, a second possible case of monkeypox in the U.S. is being investigated in New York City.
The New York Health Department says it will conduct preliminary tests, which, if positive, will be sent to the U.S. Centers for Disease Control and Prevention for confirmatory testing.
The first confirmed case was reported Tuesday in Massachusetts. Doctors there say the patient had recently traveled back to the U.S. from Canada.
That patient is currently hospitalized at Massachusetts General Hospital and is admitted to our special pathogens program. He is in stable condition.
Cases have also been reported in France, Italy, Sweden, Spain, Portugal, and Canada and the UK. The CDC is monitoring 6 people who may have been exposed to the virus when they sat near an infected traveler who had symptoms while on a flight from Nigeria to the UK in early May. None of those 6 people have shown any symptoms of monkeypox. Joining Morning Rush now is Dr. Joshua Sarfstein, Vice Dean for Public Health Practice and Community Engagement at the Johns Hopkins Bloomberg School of Public Health. Dr. Sarfstein, thank you so much for your time. Let's just start with this. Can you explain what monkeypox is, how it's contracted?
It's a virus, but it's not of the family that coronavirus is in. It's more of the family or sort of the general type of virus that smallpox is. But fortunately, it's not nearly as deadly as smallpox. It causes an infection with fevers and swollen lymph nodes that can last a few weeks, and a rash, which is why they call it a monkeypox, because the pox, it's sort of like chicken pox. You get a rash, and then it generally goes away. The type of monkeypox that is being spread around is not thought to be particularly lethal. And then there's the question of how it transmits from one person to another. I should say there are types of monkeypox that can be lethal, but so far they haven't seen that with this. Generally, it's transmitted through very close contact. Now, if there were, very easy transmission, you would expect to see a lot more cases in Europe, not just a few cases here and there. So from what people can tell, it's still pretty hard to transmit from person to person. Although, as we've learned, we have to be humble in the face of viruses. And so there'll be a lot of study to figure out maybe something's changed a little bit with this monkeypox. But I think because relatively few people have gotten it so far, I think it's going to be important, but not anything like the COVID situation.
Well, that is certainly good to hear. In 2019, the FDA approved a vaccine actually to prevent monkeypox and smallpox. How effective is that vaccine? And is it at this point worth people reaching out to their doctors about it or just knowing about it?
Yeah, that vaccine is not easily available at this point, but you're right. It's not just that there is a vaccine, there are also treatments that could work. So right now, all that is good to know. It's sort of like we have a toolbox. The most important thing is to understand what's going on, to really take great care of the people who have monkeypox or might have monkeypox, and then kind of take one step at a time. I don't think there's going to be a mass vaccination effort unless there's a real threat to a lot of people. And I think that most people think the risk of that is very, very low at this point.
So just in general, as far as the threat goes, you don't put monkeypox anywhere near COVID, do you?
I do not at this point. I think especially now that COVID is increasing here in this country, but even before that, seriously, I think this is, we see all the time, actually. We live in a world with many different types of viruses. They're constantly changing. This is why it's so important to invest in public health so we can get the best information about these threats as quickly as possible and we can be as smart as possible in how to respond.